Chances are you have bad cholesterol, you have high LDL cholesterol, which increases your risk of a heart attack or a stroke. This means that you and the rest of us should be watching what we eat, how much we exercise, and seeing our doctor regularly. For many of us, this includes being prescribed a very popular line of drugs called statins, probably for the rest of our lives. There's a good chance you also have high blood pressure, especially if you are a male over the age of 55. In 2017, the American Heart Association changed the definition of hypertension, and now if your systolic blood pressure amount is greater than 130, you are considered stage 1 hypertensive. For those individuals, especially the elderly who have been prescribed statins to treat coronary artery disease for long periods of time, they will tell you that the prevention and treatment of cardiovascular disease comes at a cost. This includes muscle aches and pains, increased risk of MCI, and in rare cases, fatal occurrences of rhabdomyolysis. What we know is that statin-induced rhabdomyolysis in patients 65 years and older is more than 5 times higher than in young adults. Statin use is the primary intervention in cardiovascular disease and promotion of HDL or good cholesterol. In 2010, the number of deaths per 100,000 individuals due to heart disease was 236. This number was even higher if you were Black. We also know that death due to heart disease happens more frequently than cancer and automobile accidents. We could see the effect that the changes in definition of hypertension have on male populations greater than 55 years of age, with 79% of this population now being considered hypertensive. When you combine hypertension with increased LDL values or bad cholesterol, there is an increased chance of cardiovascular events occurring. Those with high blood pressure and high cholesterol and have experienced angina attacks, nausea, or jaw to shoulder pain benefit from statin use as a primary prevention method. 1 out of every 3 adults in the United States has bad cholesterol. 49 million people have low HDL values. In 2014, there was a retrospective study which looked at discontinuing statins at the age of 75, which resulted in episodes of angina, heart attacks, cerebral vascular events, transient ischemic attacks, occlusion, stenosis, embolism, thrombosis, and death. The study found that patients who have stopped taking statins were 3 times more likely to have a related hospital admission. Statin use has been associated as a secondary prevention method to increase cognitive function due to the increased blood flow caused by the breakdown of the cholesterol plaque. There are conflicting studies regarding this. In a research study published in 2015, there was a slight risk of MCI that offset the benefit of decreasing cardiovascular events. Patients who are greater than 79 years of age and have bad cholesterol and being treated with statins increased from 8.8% in 1999 to over 34% in 2011. With 1/3 of the adult population in the US having bad cholesterol and 79% of men greater than 55 years of age now having hypertension, the benefit of using statins is evident. For those who do not have secondary comorbidities such as hypertension, the use of statins after the age of 75, especially if there's not been a cardiovascular event in the patient's lifetime, should be discussed with their physician about discontinuing usage, especially if the typical known side effects affect your quality of life.